with regards to the aspects of medical dermatology in the medical community, how medical dermatology should be viewed is, again, it's a specialty just as is orthopedics and ophthalmology, where everyone's been specially trained in that arena, where they have a certain skill set that in the medical community should be utilized. And I don't think every doc should refer every single little lump and bump every single time they see it necessarily. I think there should be medical discretion, but there's a lot of physicians in every specialty that really don't understand the skin at all, and which is understandable because you get about 2 hours of lecture in dermatology in medical school. So unless you actively seek that out in your residency or in medical school, you don't get much training in it. So I think there are certain specialties, and dermatology falls into that one, where most of the community doctors in primary care and in subspecialties don't know what they're looking at. And I think the ones that do a great job, but I think that's very far and few between. And so I think that's where the community and the medical community needs to be aware that as a dermatologist, this is, as far as how our practice believes, and particularly myself, is we're there as that specialty service for, or that outreach service for the medical specialists and the primary care doctors that need assistance in someone's skin disorder, because they don't have time for it, don't know what it is, or the patient's not getting better. And instead of trying 6 different creams, that's where they just say, you know what, I don't know what I'm looking at. I don't do much dermatology. I can take care of your diabetes and your heart disease, but I don't know dermatology very well, so I'm going to send you to a dermatologist. And I think from our practice and my philosophy is we're there for those physicians, and those patients should be worked in relatively quickly into a practice. They shouldn't have to wait 6 or 8 weeks or 3 months to get seen for whatever ailment they've got. It should be something, particularly from a physician referring standpoint, it should be something that you're supporting the medical community with your expertise, and you should be there for that support.